everyone. Today we're going to go over an exercise that's great for improving stability in our hips. So if you've heard of things like IT band syndrome, runner's knee, or patellar tracking disorders, things like that, those can all be related to having unstable hips, and that means that our glutes aren't able to control that hip joint as much as they're supposed to. So this exercise is going to be a transition from sitting on our side to being in this tabletop or kind of crawling position. And we're just going to alternate between the two. So before we begin to move, the first thing we're going to do is get a good belly breath. We're going to give a little bit of a brace, and then we're going to begin to hold that brace while we breathe. And we're going to sit our hip back down towards the ground. Now we're going to switch back into that crawling position. So we're going to lean forward, push our knee down into the floor until that hip comes up. And we're going to slowly keep rotating all the way through. We're going to do that a few more times. Again, we're looking for as slow and controlled as possible. You should be feeling a lot of activity in those glute muscles. So now we'll do it from the other side. And as we come again, we're thinking about sitting this hip down and back. Pivoting, pushing down through that front knee, and coming back up. This exercise looks a lot like a side bridge that we do sometimes, where we'll come up like this and then sit back down. But because we're coming up onto our hand instead, and we're including some more rotation through it, it's a little bit more of a progression. If it feels like it's too difficult to come all the way up, or as you go down, if you feel like you're just kind of falling back, it's okay to also just hold it. We're going to have that knee bent a little bit. And you should feel a lot of activity in that downside glute. So it's also fine to just hold it and breathe. If you feel like even this is too hard, you can go ahead and use your other leg for some support. And that should feel easier still, but you should still be feeling a lot of activity in that glute, and then also through the front of your core.